The malaria is transmitted by the bite of infected mosquito.
Dr. Ahmad, how are you today?
Fine, alhamdulillah, thank you so much.
Who are the people most likely to get malaria?
Malaria can infect any age, starting from newborn up to elderly. Any age is susceptible to malaria, but sometimes it's more severe in the extremes of life and in pregnant ladies. The malaria history started from the 18th century when we discovered this Plasmodium, the one parasite infecting causing the malarial disease, has been discovered in 1880 in Algeria by one of the French consultants of the microbiology. There is 5 types of malaria. The most common type is the malaria falciparum malaria, which is sometimes the most serious type. We have other types like Vivax, Oval, malaria, and Walisi in the Southeast Asia. The mild symptoms of malaria sometimes started by the fever, body aches, vomiting, diarrhea, abdominal pain. It can cause also jaundice, bleeding tendency, liver failure sometimes, kidney failure, and even coma and convulsion. It's called cerebral malaria or malignant malaria. And this is the most common forms of malaria.
How is malaria transmitted and how can it be avoided?
The malaria is transmitted by the bite of infected mosquito. If the person is infected with malaria, the mosquito will bite this patient, and then this mosquito will be infected with Plasmodium falciparum or Plasmodium type of. If it bites another patient, it will cause starting the malaria. There is 2 forms or 2 cycles of malaria in the body. It will start by the liver, and then start dormant inside the liver, and then will go to the blood and start replicating in the red blood cells, causing destruction of the RBCs, causing severe hemolysis and anemia, and one of the most important manifestations, the fever and rigors. These manifestations can be sometimes severe and sometimes can be mild disease. How to avoid? At first, you should be, if you are going to malaria, we'll give you medicine to protect you from malaria. This medicine is starting from 1 to 2 weeks before you travel. And then during travel, you will take that medicine. And then after you come back, you will take medicine for 4 weeks. During your travel in that areas, malarious areas, you will protect yourself by long sleeves. You will take mosquito repellents, put it on your, you should protect yourself from going out during the dawn or during the times the mosquito will be infective and causing that disease.
Is it considered infectious?
It is infectious. There's many types of infections or many ways you can get the malaria. The most common is this mosquito bite. The other type, sometimes the mother, if infected, can infect the baby. Also blood transfusion. For all cases of blood transfusion, we are doing malaria film to prevent any malarial transmission. Sharing needles also can cause this infection with malaria. So it is infectious disease, but not infectious from one patient to the other. You should have the mosquito, which bite the infected person, and then will go to the other person to infect him. There's not direct transmission between people, the malarial infection.
What are its symptoms, and can malaria be treated?
Yes, the range of symptoms of malaria sometimes from mild symptoms up to severe symptoms up to deep coma. Thank you so much. The malaria sometimes can present with just only fever, body aches, rigors, vomiting, diarrhea, and sometimes the symptoms can be more severe up to cerebral malaria or deep coma or convulsions, severe hypoglycemia, deep jaundice from the destruction of the red blood cells. As we said before, we have 2 forms or 2 cycles of malaria in the body, one on the liver, and then it will be sometimes dormant. 2 types of malaria can be dormant and then become recurrent, coming like the Vivax and Oval. These 2 types can be sometimes recurrent malaria. And then the other cycle in the red blood cells with severe destruction, causing hemolysis, jaundice, and sometimes acute renal failure or acute renal shutdown. And so the symptoms can be either mild, moderate, or severe. We should have high index of suspicion for returning travelers from either the Africa or Southeast Asia. The malaria can be either drug sensitive or drug resistant. And then how can be treated? We have a lot of treatment according to the type of malaria and severity. For the form of malaria like the malaria or the Vivax or Ovan, this can be treated just with chloroquine. Other medications can be given, also available. We have the mefloquine, we have the quinine clindamycin, which is used on more severe, in the more...
Thank you for your insights on malaria, doctor. Do you have any advices?
The most important advice for you all, please, before you travel to these areas of malaria, the mosquito repellents, and then protect yourself with long sleeves. And when you come back from travel, please come to us to do another test if you have symptoms, and then to continue that medications on coming back. God bless you and thank you.